Hello everyone, and welcome to today's lesson on the unusual or atypical symptoms of colon cancer, also known as colorectal cancer. While many of us are familiar with the more common symptoms like changes in bowel habits, abdominal pain, and unexplained weight loss, today we'll dive into some of the less obvious signs that could indicate colon cancer. Understanding these unusual symptoms can potentially save lives by leading to earlier detection and treatment. Before we jump into the unusual symptoms, let's briefly talk about what colon cancer is. Colon cancer is a cancer that starts in the large intestine, colon, or the rectum, which are the final parts of the digestive tract. It is one of the most common cancers worldwide, ranking third or fourth in incidence, depending on geographic location. The risk factors for colon cancer include older age, usually over 50, low fiber intake, family history of colorectal cancer, a history of inflammatory bowel disease, IBD, such as ulcerative colitis or Crohn's disease. Alcohol consumption and a sedentary lifestyle also increase the risk. Now, let's get into the topic at hand, the unusual symptoms of colon cancer that are often overlooked. Symptom 1, abdominal distension and bowel obstruction. One unusual sign of colon cancer is abdominal distension. This occurs when the abdomen becomes swollen and protrudes outward, often resembling bloating. This can be caused by a bowel obstruction due to a tumor in the colon. When a cancerous tumor grows large enough to block the passage of stool through the intestine, it creates a physical barrier. Mechanism: the blockage causes a buildup of gas, stool, and fluids in the digestive tract. This not only leads to abdominal distension, but also nausea, vomiting, and severe discomfort. Statistics: bowel obstructions occur in up to 15 to 20% of patients with colon cancer, particularly in cases involving the left side of the colon, where the diameter of the intestine is narrower. If you or someone you know experiences a protruded abdomen, along with nausea, vomiting, or constipation that doesn't resolve, it's crucial to seek medical attention. This could be an early sign of a tumor blocking the bowel. Symptom 2, tenesmus and rectal pressure. Another unusual symptom is tenesmus, a condition where you have a persistent urge to have a bowel movement even when your bowels are empty. This sensation often comes with rectal pressure or pain, especially in cases where the cancer is located in the rectum. Why it happens? The tumor in the rectum can create the sensation that there's stool needing to be passed, even when there isn't any. You may also feel like you haven't completely emptied your bowels, despite frequent trips to the bathroom. These symptoms can easily be mistaken for hemorrhoids or irritable bowel syndrome, IBS, leading to delays in diagnosis. Symptom 3, uncommon bleeding patterns. While blood in the stool is a commonly recognized sign of colon cancer, the type of blood can vary, leading to different presentations. Two terms often used are melanaeous black, tarry stools, which indicate bleeding higher up in the digestive tract. Hematochezia, bright red blood in the stool, often from bleeding closer to the rectum. Why it's important: melena suggests a tumor in the right ascending colon where the blood has time to be partially digested, resulting in the dark color. Hematochezia is more common with cancers of the left side or rectum, where the blood appears fresh and red. Statistics: research shows that iron deficiency anemia due to occult bleeding is present in 10 to 15% of colorectal cancer cases. This bleeding may not be visible, leading to gradual blood loss and symptoms like fatigue, pale skin, and shortness of breath. Symptom 4, iron deficiency, anemia, and unusual signs. Iron deficiency anemia is another atypical sign of colon cancer. This happens due to the slow, continuous loss of blood in the stool, either visible or hidden, occult bleeding. When your body loses blood, it compensates by producing more red blood cells. But to do that, it needs iron, and over time, your body's iron stores become depleted, leading to anemia. Signs of iron deficiency, anemia. Fatigue and weakness. Shortness of breath. Restless leg syndrome. Angular cheilitis, which is cracking at the corners of the mouth. Koilonychia, or spoon-shaped nails. Statistics. In up to 30% of colon cancer cases, iron deficiency anemia is one of the earliest signs. This can occur without any visible bleeding, making it harder to detect unless blood tests are done. Symptom 5: endocarditis and Streptococcus bovis infection. This next symptom is quite unusual and often goes unnoticed in connection with colon cancer. Endocarditis, an infection of the inner lining of the heart, can be a sign of colon cancer when caused by the bacterium Streptococcus bovis. Mechanism. Streptococcus bovis, a bacterium commonly found in the gastrointestinal tract, can enter the bloodstream if there's a disruption in the colon wall, such as from a tumor. Once in the bloodstream, it can infect the heart valves, leading to endocarditis. Key point. If a patient develops endocarditis caused by Streptococcus bovi, studies have shown that there is a 25 to 80% chance that they also have colon cancer. This makes it crucial for patients with this specific type of infection to be screened for colon cancer. Symptoms: 6 gas gangrene and Clostridium septicum gas gangrene is another rare but serious condition that can be associated with colon cancer. This occurs due to an infection by Clostridium septicum, a bacterium that thrives in low-oxygen environments, such as inside tumors. How it happens? If colon cancer causes tissue death or reduces oxygen flow to the area, it creates an ideal environment for Clostridium septicum to grow. This bacterium can produce gas within the tissues, leading to the formation of gas gangrene, a potentially life-threatening condition. Although rare, it's important to be aware of this connection, as early intervention can save lives. Symptoms 7. Dermatological signs. Colon cancer can sometimes present through skin changes, which are often overlooked. One such sign is acanthosis nigricans, which is a condition characterized by dark velvety patches of skin that typically appear in body folds like the armpits or groin. Key points. Although commonly associated with insulin resistance, for example in diabetes, it can also be a paraneoplastic syndrome, meaning it's triggered by the presence of cancer. Another skin-related sign is lesser tralas sign, which is the sudden appearance of multiple seborrheic keratoses or benign skin growths, often accompanied by itching. Why it's important. When this sign occurs suddenly and rapidly, it may indicate an underlying malignancy, including colon cancer. Symptoms 8. Metastasis and hepatomegaly. One of the more common sites where colon cancer metastasizes is the liver. When this happens, you may experience symptoms related to liver dysfunction, such as hepatomegaly or an enlarged liver. Ascites, which is a buildup of fluid in the abdomen. Statistics. Liver metastases occur in about 20–70% of patients with advanced colorectal cancer. In conclusion, while the more common symptoms of colon cancer, like changes in bowel habits, abdominal pain, and weight loss, are critical to recognize, it's just as important to be aware of the unusual symptoms. These less-known signs, such as abdominal distension, tenesmus iron deficiency, anemia, endocarditis, and even skin changes can often provide the first clues to a diagnosis. Remember, colon cancer is highly treatable if caught early, with a 5-year survival rate of 91% when diagnosed in the early stages. Regular screenings, such as colonoscopy, and being aware of both common and unusual symptoms can make all the difference. Thank you for taking the time to learn about this important topic today. If you found this information helpful, please share it with others who may benefit, and don't forget to like, share, and subscribe for more health-related content. Stay informed, stay healthy, and take charge of your well-being. Wherever you are, have a good morning, good afternoon, or good evening, and see you soon.